an objective assessment of the situation, I think we are the first to recognize some significant changes in the manner of managing our outstanding validated claims. I would concede that for the first time in many months, we've started seeing consistent payment of some of the outstanding claims. Be it as it may, the situation is not altogether all right. We recognize the efforts of the government in addressing the seemingly chronic debt. We are hoping that in the not too distant future, we will see a well-restructured payment mechanisms that are not only timely, but also adequate, that is also paid at the right time, at the right moment, to enable providers render the quality, affordable and equitable healthcare that we are expected to provide.
At the last count, CHAG was saying that the NHIS owed its members over 200 million cedis. How much of that has been covered by now?
Yeah, offhand, it will be difficult to really validate the current outstanding claim. Be that because every month, every moment, we submit claims to the NHIS. So, but we would say that much as we submit the validated claims at all times, we would expect the government to respect within the 90-day period to process the claims, validate it, and then pay on time. I would say that even though the government is doing well with the payment mechanisms, I think that much more needs to be done. Even one, not only the timely payment of it, one is the adequacy. Remember, over the past 2-3 years, the tariff structure, medicine prices have not been reviewed. So what the government is doing now is settling outstanding claims, most of them whose real value have been depleted. If you owe me for the past 2 years and you paid me this year, well, we are happy, but we are not so much excited because most of these are monies that we've had to pay to our outstanding suppliers. So we are hoping and praying that moving forward, the NHIS will be restructured, re-engineered, and retooled for it to be more effective, efficient, equitable, and accountable, not only to providers, but to the good people of Ghana, so that the objects of the National Health Insurance Scheme, which supposedly, or which is supposed to improve or facilitate access to quality, affordable healthcare, will be realized as soon as possible.
So currently as it stands, am I to maybe conclude that the debt that threatened to probably shut down some of your facilities gradually have been cleared, and there isn't any threat of those facilities running down because of debt?
Yeah, I would put it this way, that the scale and scope of the debilitating debts that engulf providers is being managed in such a way that the challenges we had are being mitigated. Be it as it may, I will still concede that the situation is not 100% all right. There are inherent challenges with the way and manner claims are even processed, with the timeliness of payment and adequacy of the payment. I think there are fundamental operational issues that we have to look at. Nonetheless, we acknowledge the efforts of the government in addressing the challenges of the NHIS. But be it as it may, the National Health Insurance Authority and the National Health Insurance Scheme needs an immediate retooling and restructuring for it to be more effective and efficient to all stakeholders, especially providers that happen to be the face of the National Health Insurance Scheme.